Welcome. This section of the Vanderbilt's Video Atlas is on congenital simple RPE hamartomas of the pigment epithelium. They've also been called pigment epithelial adenomas. A hamartoma, as you know, is described as a mixture of non-cancerous cells near the location where the cells normally should be found. Dr. Lacqua first described this entity in 1982 as a solitary black lesion near the fovea. Dr. Gass gave it its name in 1989 when he described 3 patients with this lesion. The lesions are generally solitary and usually found in the temporal macula, although if you look at Gass's atlas, they can occur any place in the macula. The location in the retina can be described as either superficial, full thickness, or full thickness with a minor amount of vascularization. The largest series to date is by Shields et al., and they have a series of 5 patients. They reported that usually the vision is good, the size is about 1 millimeter, slightly elevated. Zola, on his study with OCTA, showed that there were some dilated feeding vessels, and others have reported a mild amount of vitreoretinal traction. This is a clinical photograph of one of my patients. He was a 6-year-old boy at the time. The vision was 20/20, and the lesion was found on a routine examination. In this particular patient, you can see the very dark pigmented lesion just temporal to the fovea. There are some RPE changes around it, but this has not necessarily been described in previous cases. Bujari et al. Hypothesized that the origin of these lesions came from inner retinal progenitor cells which did not differentiate properly, and the cells became RPE-like cells with hyperplasia and fibrosis. Barnes looked at a lesion histologically and found hyperplastic cells and gliosis. They presumed that these cells in this lesion came from cells which migrated during embryogenesis. This is the OCT of my 6-year-old patient. It is classic of an OCT for these RPE adenomas. There is a hyper-reflective mass that looks to be very superficial in the retina, and there's very dense shadowing posteriorly. The borders are sharp. Some people have shown a vitreolesional adherence, which my patient did not demonstrate. Shields et al. Studied 5 patients with simple hamartomas with angiography. They noted that the central area blocked dye, as one would expect, and some had a late halo of hyperfluorescence in the late phases. Zola studied 1 patient with both fluorescein and OCTA. The OCTA of Zola's patient showed a flow signal at both the inner and the deep capillary plexus. The West Coast Retina Case of the Month shows a wonderful example and discussion of this entity as well, and it was published in April 2011, and I encourage you to go take a look at their example and their discussion as well. And here are the first 7 references for this chat.